What if I told you that one of the biggest reasons people over 70 fall is not weakness, not bad luck, and not even poor balance in the way most people think about it? It is something much simpler than that. It is the loss of one very basic movement your body was designed to do automatically every single day. And when that movement starts to fade, getting up from a chair, stepping off a curb, turning too quickly in the kitchen, or even walking across your own living room can suddenly become the moment everything changes. One slip, one hard fall, one injury, and life can become divided into two parts, before the fall and after it. I am not saying this to scare you. I am saying it because too many people wait until after the fall to finally take this seriously. And that is exactly what I do not want for you. Because the truth is, there is one simple daily exercise that can help rebuild the strength, control, and confidence your body needs to stay upright. It takes just a few moments. You do not need a gym. You do not need fancy equipment. And if done consistently, it can make a very real difference in how steady and secure you feel on your feet. Today, I am going to show you what that exercise is, why it matters so much after 70, exactly how to do it safely at home, and how to make it part of your day in a way you will actually stick with. And please stay with me until the end, because I am also going to explain the one mistake I see older adults make with this movement all the time, and that mistake can completely cancel out the benefit. Before we begin, if you have not subscribed to Dr. Arthur yet, I strongly encourage you to do that now and turn on the bell notification, because this channel is here to help you stay strong, mobile, and independent for as long as possible. And if this video helps you, type the number 1 in the comments below. If you feel I could explain something more clearly, type 0. I read those comments carefully, and they help me make these videos better for you. Now let me ask you something. When most people think about preventing falls, what do they focus on? They think about walking more carefully. They think about holding on to furniture. They think about buying better shoes. And yes, some of those things can help. But very few people focus on the one moment when falls often begin. Not while walking, not while standing still, but during the transition between sitting and standing. That moment right there is where balance, leg strength, coordination, and reaction speed all come together. And if your body cannot handle that transition smoothly, safely, and confidently, your fall risk goes up far more than most people realize. That is why the simple exercise I want every person over 70 doing daily is this: the sit to stand. Yes, that's simple. Standing up from a chair and sitting back down with control. It sounds almost too basic to matter, but do not underestimate it, because this one movement trains several of the exact things that protect you from falls in real life. It strengthens your thighs. It strengthens your hips. It strengthens the muscles around your knees. It improves your core stability. It trains your balance during movement. And perhaps most importantly, it teaches your body how to shift weight safely and regain control the moment you rise. That matters more than people think. Because a great many falls do not happen when someone is already walking comfortably across the room. They happen at the start of movement. They happen when a person pushes up too quickly, feels unsteady, their legs do not respond well enough, and the body cannot recover in time. That is why this matters. And here is something I want you to understand clearly. After 70, the body naturally loses muscle mass faster than it used to. Reaction time slows down, joint stiffness increases, and if you spend long periods sitting, which many older adults do without even realizing how much, the exact muscles needed to get you upright become weaker and less responsive. So it is not just that the legs get weaker, it is that the brain and body stop working together as efficiently during one of the most important movements of daily life. That is the real issue. And the beautiful thing about the sit-to-stand exercise is that it retrains both. It is not just strength training, it is function training. It is training for real life. Before I show you exactly how to do it, I want to give you a few important safety reminders, because your safety always comes first. If you have had a recent fall, especially one that caused pain or injury, please speak with your doctor or physical therapist before starting any new routine. If you have severe knee pain, severe hip pain, dizziness, fainting episodes, Parkinson's disease, or any neurological condition that affects your balance, please get medical guidance before trying this on your own. Use a sturdy chair, not one with wheels, not a soft couch, not a chair that slides. A firm, stable chair is what you want. And always make sure the floor beneath you is not slippery. If anything causes sharp pain, dizziness, or a feeling that something is simply not right, stop immediately. There is no benefit in pushing through something unsafe. Now let us go through the exercise together. Sit near the front edge of a sturdy chair. Place both feet flat on the floor about hip-width apart. Bring them slightly back underneath you, not too far forward. This is important because if your feet are too far out in front, standing becomes much harder and less stable. Sit tall. Keep your chest lifted. Now lean your upper body slightly forward. I want you to remember this phrase, nose over toes. That small forward lean helps shift your body weight into the right position to stand. Then press through your feet and stand up slowly, not with a sudden push, not with a jerking motion. Stand with control. Once you are fully upright, pause for a second or two. Feel that stable standing position. Then slowly lower yourself back down into the chair with control. Do not just drop. Do not collapse down. Lower yourself gently. That is 1 repetition. Now here is where many people make the mistake. They rush it. They swing themselves up. They use momentum instead of muscle. Or they crash back into the chair on the way down. That may feel easier in the moment, but it takes away a huge part of the benefit. The real power of this exercise is in the control, especially the lowering phase. That is what strengthens the muscles and trains stability. If you can only do a few repetitions at first, that is completely fine. That does not mean you are failing. It means you are starting exactly where your body needs you to start, and that is the right place to begin. If standing without help is too difficult at first, place your hands lightly on the armrests or on your thighs. Use just enough help to get through the movement safely. Over time, the goal is to rely on your hands less and less. Eventually, many people can work toward crossing their arms over the chest while doing the exercise, but only when it feels safe. There is no prize for rushing. There is only progress through consistency. So how many should you do? Start with 5 repetitions. That is enough for many people in the beginning. If that feels manageable, work toward 8, then 10. For many older adults, a very good goal is 10 controlled sit-to-stands once or twice a day. That is more than enough to begin making meaningful progress. And if 10 feels too easy after a while, you can slow the movement down even more. For example, take 2 seconds to stand, pause at the top, then take 3 seconds to lower back down. That slower pace makes the exercise much more powerful without needing extra equipment. Now let me explain why this one exercise can be such a game changer for fall prevention. When you stand up from a chair properly, your body has to coordinate your feet, ankles, knees, hips, and core all at once. It has to shift your center of gravity forward. It has to produce enough force to lift you. And then it has to stabilize you once you are upright. That is exactly the kind of coordination you need in the real world. That is why this movement carries over so well into daily life. Getting out of bed, getting off the toilet, standing up from the sofa, rising from the dining chair. All of these moments become easier and safer when this pattern gets stronger. And when those moments become easier, something else starts to happen too. You begin to trust your body again. That matters deeply. Because fear of falling does not just affect your legs. It affects your entire life. It makes people walk less, go out less, reach less, do less. They become cautious in ways that slowly shrink their world. And the tragedy is that the less they move, the weaker they become. And the weaker they become, the more likely they are to fall. That is the cycle we are trying to break. The sit to stand is one of the simplest ways to begin breaking it. Now I want to show you how to fit this into your day so it actually gets done. Do not think of this like a workout you need to set aside a whole hour for. That mindset is exactly why so many people never stay consistent. Instead, attach it to things you already do. Do 5 sit to stands before breakfast. Do another 5 before lunch. Do a set before dinner, or do them every time you get up to make tea or coffee. These tiny moments matter. In fact, short bursts spread throughout the day are often easier to stick with than one long session. And when something is easier to stick with, it is more likely to change your body. Consistency beats intensity nearly every time, especially after 70. Now there is one more thing I want to say, because it is very important. Do not skip this exercise on the days you feel good. Those are the days people tell themselves, I am fine today, I do not need it. But those are often the most important days to practice, because you are not just training for today. You are training your body for that unexpected moment in the future when you lose your footing, get bumped off balance, or need your legs to react instantly. You are building the reserve now that may protect you later. That is what this is really about. Not exercise for the sake of exercise, not chasing fitness, not trying to become someone you were 30 years ago. This is about protecting your independence. It is about making sure your body can keep carrying you where you want to go. It is about standing up with confidence, walking with more security, moving through your home without that quiet fear always sitting in the background. And I want you to hear me clearly on this. You are not too old to improve this. You are not too far gone to get stronger. And you do not need perfection for this to help you. You just need repetition. Safe, steady, daily repetition. That is where change happens. If all you do starting today is 5 good sit-to-stands every day, done with full control, you will already be doing something powerful for your legs, your balance, and your future safety. Then, as your confidence grows, you can build from there. Because the goal is not simply to avoid falling. The goal is to keep living life on your own terms. Now, if you want the best results, remember this: balance and leg strength work together. And while the sit to stand is one of the best daily exercises you can do, it works even better when paired with a few other safe movements for strength and stability. That is why, here on Dr. Arthur, I continue to share simple, practical exercises designed specifically for adults over 70. If this video helped you, type 1 in the comments below. If you want me to make more videos like this, let me know. And if you have not subscribed to Dr. Arthur yet, make sure you do that now. Thank you so much for watching. Take care of your body, move with confidence, and here is to staying strong, steady, and independent for many years to come.